The number of people testing positive for COVID-19 is growing to a rate not yet seen by many Montana counties, including Missoula. But what's being done to slow this surge?
So last year, when we started experiencing a spike, we were able to limit group sizes and events and mandate masks, and those were all the things that helped us to get through that spike in a matter of a couple of months and not get as many cases as what we're seeing now.
New state laws changed the approach of local health departments statewide. At the state legislature, House Bill 121 removed the ability for health boards to implement rules surrounding COVID-19. Rules instead must be approved by a local governing body like City Council. The law also changed a health rule violation from a misdemeanor to a civil penalty. Another law added fallout to strict health measures. House Bill 632 enacted the American Rescue Plan Act in Montana. In the text, a clause states that if local governments impose more strict COVID-19 regulations than the state, federal funding for local water and sewer infrastructure projects is reduced by 20%.
And that's millions and millions of dollars that we would not be able to get into the Missoula economy.
This point was brought up on the final legislative day, April 29th.
The 20% reduction in grants to me is a discrimination against communities that want to protect and do the right thing, protect the public health of their residents.
More than $460 million was allocated to Montana for these sort of projects.
I don't look at it as a reduction. I look at it as use of their money to partner up to see who is serious about the grants.
Because of these changes, the Missoula City County Health Department put stock in their remaining option.
As far as quarantine and isolation, that is the one mitigation strategy that we are still legally able to do in Montana.
An app called Sarah Alert is used for monitoring. Once per day, symptoms are self-reported. Normally, calls are also made to check on people, but the health department is understaffed by about 75 positions and doesn't have that capacity. Farr said there's been more complaints lately.
Primarily coming from employees who are being told by their employer that they have to come to work even if they are sick with COVID.
In response, employers are called to try to answer any questions. People also aren't getting tested during initial symptom onset.
More and more people are waiting a long time to get tested. And so and usually by the time that they do get tested, they're getting tested because they're getting admitted to the hospital because they've been so sick.
The worsening strain on the healthcare system isn't the only crisis Montanans currently face. As we reported on MTN News, there's a growing cost of living in Montana, along with worker shortages across industries. So healthcare officials rely on one primary tool for fighting this surge: personal responsibility. In Missoula, Geneva Zoltek, MTN News.